Hello everyone, I'm Dr. Mangs and welcome back to our channel. Today we're going to explore a condition that affects many women, uterine fibroids. Let's dive in. Fibroids are also known as leiomyomas or myomas. These are non-cancerous growths that develop in the uterus. They can vary greatly in size, number and location. Fibroids can be found within the uterine wall, where they're called intramural, or they can be bulging into the uterine cavity, where they're called submucosal, or projecting to the outside of the uterus, where they're called subserosal fibroids. Some fibroids remain very small, while others can grow large enough to be the size of a bowling ball and alter the shape of the uterus. They are extremely common tumors, with estimates suggesting that up to 70 to 80% of women will develop them by the age of 50. Risk factors include African American heritage, obesity, family history of fibroids, early onset of menstruation, and diet high in red meat. So what causes fibroids? While the exact cause remains unclear, we do know that several factors contribute to their development. Genetic influence. A family history of fibroids increases your risk. Hormonal factors, where estrogen and progesterone, the hormones that regulate the menstrual cycle, also stimulate the growth of fibroids. Substances like insulin-like growth factor may play a role in fibroid growth. Let's talk about symptoms. While some women experience no symptoms at all, others may face significant issues, and the most common symptoms associated with fibroids are heavy menstrual bleeding, that are periods that are prolonged or unusually heavy, sometimes with clots. Pelvic pain and pressure. Persistent pain or pressure in the pelvis, lower back or legs. Frequent urination can occur when the fibroid and the uterus enlarged is putting pressure on the bladder in front. Constipation can occur similarly when pressure is exerted on the rectum, leading to constipation. Pain during intercourse. Discomfort or pain during sex can occur when the fibroids are lower down towards the cervix and at the top of the vagina. Enlarged abdomen. There is a noticeable swelling or bloating in the lower abdomen, especially seen with larger fibroids. The impact on fertility. While many women with fibroids can conceive and carry a pregnancy to term, fibroids can sometimes interfere with fertility and pregnancy. They may cause difficulties with implantation of the embryo, increase the risk of miscarriage, or lead to complications during pregnancy and delivery. Sometimes a fibroid can undergo painful degeneration during pregnancy. Diagnosing fibroids typically involves a pelvic exam, but imaging tests like ultrasound or MRI are often used to confirm the diagnosis and assess the size and location of the fibroids. Now let's explore treatment options. Treatment depends on the severity of symptoms, the size and location of the fibroids, and whether a woman wishes to preserve her fertility or not. Here are some common approaches. Medications, hormonal treatments, and NSAIDs or painkillers can be used to help manage symptoms. Minimally invasive procedures like uterine artery embolization and myolysis are options that target fibroid growth. Surgical options. Myomectomy involves removing the fibroids while preserving the uterus. Most of these surgeries can be done via laparoscopy, and very rarely an open surgery is needed for very multiple fibroids or extremely large fibroids. In most cases, it will be performed at the surgeon's discretion and skill level. In more severe cases, a hysterectomy or removal of the uterus may be necessary for very significant fibroids. MRI-guided focused ultrasound. This non-invasive treatment uses high-intensity ultrasound waves to focus at the center of the fibroid and causes apoptosis, which is basically destroying the fibroid tissue from the core. This provides symptomatic relief but does not remove the fibroid itself. It may shrink the size of the fibroid because burning the center of the mass will interrupt the blood supply, which can cause shrinkage, which may help in reducing the symptoms such as bleeding and improving fertility. We don't have long-term data regarding these outcomes as yet. Beyond medical treatments, lifestyle adjustments can also help make a big difference. Maintaining a healthy weight, regular exercise, and a balanced diet rich in fruits, vegetables, and omega-3 fatty acids can help manage symptoms. Some women find relief through alternative therapies like acupuncture and physical therapy. Living with fibroids can be challenging, but there are effective treatments and support available. If you suspect that you have fibroids or are struggling with symptoms, it's important to speak with a healthcare provider. Remember, you're not alone and there are many resources out there to help you. Thank you for watching. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to our channel for more information on women's health. Leave any questions on topics you'd like us to cover in the comments below. Take care of your health and we'll see you the next time.